I am Dr. Sajal Halder, a board-certified plastic surgeon at Orange Tree. I will be talking about hidradenitis suppurativa, its causes, the presentation and the treatment option available to us. Hidradenitis suppurativa is a chronic inflammatory process that involves the skin, and it presents with nodules, abscesses, discharging sinus, and it's a nagging and chronic problem, and it often debilitates the individual and affects the quality of life. Therefore, the treatment becomes paramount. Before that, we will be talking about what are the presentation with which the patient comes. Patient can come with one-off nodules, tender swelling in the armpit area, which is not resolving. So initially most of these cases will be managed medically, where we try to give some medication in the form of antibiotic, retinoids and other locally injectable treatments. But as the process goes on and recurrences keep happening, then the patient presents with sinuses, nodules, scarred skin that affects all over the axillary area. As we will be showing you a preoperative picture of a patient who has been operated at our clinic with the same problem, we see there are multiple sinus tracts, there are nodules in the skin is thickened and it looks very scarred, and it's very tender to the patient, and it affects the normal day-to-day activity. So this group of patients will require surgical management who are not being able to manage by the medical therapy. So surgical treatment is divided into three parts. One is the excision of the area that is involved, that will include excising the scarred skin, including nodules and the sinus tracts. And once the excision is complete, when we have a healthy bed, then we can either cover it by skin graft or by a local flap. If the infection is quite extensive, deep, then local flap becomes important. Otherwise, most of the situation we would be able to cover it with skin graft and the result is pretty good. In this case also, which we have operated, we have excised the involved segment of the hidradenitis suppurativa component in the axilla, and thereafter we have put a skin graft immediately, and we will be showing you the immediate post-op of 10 days where the patient's graft has healed well and it's almost looking natural. There are little pigmentation and marginal redness that will heal in another week's time. Now, after the procedure is done, following the discharge, the patient is put on a splint because the arm has to be abducted. If the arm is not abducted and kept in an immobilized position, the graft will move, and therefore the graft take or the graft survival becomes less, or the graft loss becomes higher. So to prevent that, what we do, we apply a splint, which we call it an aeroplane splint, because the arms is just at 90 degree as of the wing of the aeroplane. So this is immobilized for at least 7 days so that the graft is secured in the axillary bed and it doesn't move, and therefore the graft take is better. This is a surgical management of the condition using skin graft, not a flap. In difficult cases where the scarring is extensive and the depth infection is quite predominant, then flap becomes an alternative choice to cover the area. So this is a condition which you should not take it lightly, because if you delay the treatment, the sinuses multiply and the area also increases. The involved area also increases, therefore the magnitude or the extent of the surgery also increases. So we have to come or get a solution to this problem in the earlier stage. Also, we have to remember that laser hair reduction is very important for the prevention. Once you are in early stage of treatment, when we have treated one or two few swelling with nodules or which has discharged pus, then following that we can use laser hair reduction to reduce the bulk of the hair in the armpits, therefore reducing the incidence of boils or nodule formation. I hope this knowledge will be handy, and if you are suffering from the same problem, you will seek medical advice and get treated. Thank you so much for watching, and keep referring our channel to your friends and relatives, and press the like button for this video. Thank you so much.